So at this point of the interview process, we're going to begin your orthopedic assessment. So we're going to start off with a postural assessment. So as best you can, I know that you have a really acute ankle sprain right now and that you are sort of favoring your left-hand side. But as best you can, I want you to come and stand so I can get sort of a normal posture for you right now. Okay, all right. So, yeah, if you could take your sweater off, that'd be great. Yeah, thanks. No, yeah, that's good. So do you mind if I just feel around a little bit? I'm going to palpate.
Sure.
Okay. So, all right. So it looks like you're a little flat-footed on this side. I think that's probably from the extra weight you're bearing on your unaffected side.
Mm-hmm.
So I'm just going to palpate here. Yeah, so. Okay. Yeah, so you're elevated a little bit on the right because your weight is being carried on your left. So, yep, just look at me, stand tall, shrink your shoulders a little bit. Yeah. Okay. Same thing on this side. Okay. And now I am just going, so what we're gonna do now is a gait analysis. So I'm gonna get you to walk towards me and then walk away from me, and I'm just gonna see how you carry your walk.
Sure.
So go ahead, come to me. Okay, that's good enough. And now back. All right, that's good. So I am gonna get you to just sit down again. So from what I could tell from your postural assessment, I mean, I can see that there's visible swelling in your ankle. It looks like you're elevated throughout the right-hand side because you're carrying all your weight on your left. And then with your gait analysis, I'm just gonna add that in there. Most of the weight is shifted to your left, so your swing phase is a lot longer on your left-hand side than it is on your right, which we do call an antalgic gait. And it just feels like you're sort of hypertonic throughout that left-hand side. You do drop your right hip a little bit when you're walking. And that is because you're carrying all your weight on your left-hand side and you don't want to put any weight on your right. So now I will get you to sit up here on the end of the table. And if you don't mind, I'm just going to palpate a little bit, just so I can sort of get the difference between the two. Oh yeah, so you're just tight. Through here.
That's tender.
That's tender?
Very tender, yeah.
Yeah, I'm barely even touching it all. I definitely feel some swelling. It's very hot. Yeah, and I mean, I'm barely touching you and you're telling me that it's sore. Okay. I'm just going to add that in there. All right. Great. Okay, so at this point, we're going to go through some ranges of motion. I am going to do it bilaterally because I want to see your unaffected side versus your affected side. So I'm going to start with your left because that's your unaffected side. What I'm going to get you to do is bring your toes up to your nose. Okay. Great. Okay, so that is looks like 40 degrees. That's normal. And now I'm going to get you to point your toes down.
Okay.
Great. So that looks like about 20 degrees, which is normal.
Okay.
I'm going to try to get you to bring the plantar surface of your foot in.
Okay.
Yep, and I'm just going to get on this side. Great, and then the other way.
And that way.
As much as you can. That one's a little bit tougher, just because of the way the body's made up. All right, so inversion and eversion are 30 and 15. That's normal. Now I am going to continue with all the tests on this side. So I'm just going to do passive range of motion here because I want to test the non-contractile tissues within your ankle.
Okay.
So I'm going to go up. Any pain there?
No.
Down. Any pain? No. In. Any pain?
No.
Out. Any pain?
No.
Nope. Okay, great. Those are all within normal limits. Now we're going to test your isometric resisted muscle contraction. So I'm going to apply resistance to the top of your foot.
Okay.
Bring your toes up.
Like that?
Yep. 5 at a 5, great, same thing going down, 5 at a 5, awesome. This one's a little bit more awkward, but I'm gonna try to get you to bring your toe, yeah, 5 at a 5, same thing, 5 at a 5, awesome. Okay, so those are all within normal limits. That looks pretty good to me, and it gives us a good baseline to see how the acute side is doing. So, for this one, what I want you to do is, without causing too much pain, I want you to see how much range of motion you can get.
Okay.
So, toes up to your nose.
Okay.
Ooh, not very much at all.
Yeah.
That looks like 5 degrees to me, if that.
Yeah.
And now I'm gonna get you to go down. There's like nothing there. That's again a little bit of range of motion, but maybe 5 degrees. Okay. Now I'm just gonna get you to. Can you bring the base of your foot in? No?
I don't think I can.
No. And what about out? No, nothing.
It just
0.
hurts. It
Okay.
hurts.
So now I'm gonna do passive again, just to test the non-contractile tissues.
Yeah.
Yeah. Okay. Yeah. So that's pretty boggy, aqueous. That's not within normal limits. I should feel a little bit of tissue stretch, and it just feels kind of empty to me.
Okay.
Now, I'm gonna apply just some resistance. Do you have any, no, yeah. There's a little bit, that's a 1 out of 5 and down.
Mm-hmm.
Yeah, that's a 1 out of 5.
Yeah.
Yeah, you have a little bit of contractibility within your ankle, but not enough to give you more than a 1 out of 5. So that's a good baseline for us to start with, for future reference. Now, what I'm gonna do, I'm just gonna add all of that in. Awesome. So at this point, I'm gonna test we're gonna do the Thompson's test.
Okay.
So I'm going to get you to turn onto your stomach without sort of injuring your ankle. Yeah, take it easy.
Okay.
So now testing the unaffected side, we are going to, the Thompson's test tests for a couple of different things. A deep vein thrombosis, Achilles rupture, and then gastroc and soleus pathology.
Okay.
So basically all I'm gonna do is I'm gonna squeeze your calf, and what I'm looking for is that motion in your ankle, which means that you do not have Achilles rupture.
Good.
A deep pain in your calf, which would indicate possibly a DVT, or a gastroc or soleus pathology. So this side tested negative because you're not creating any pain. No. And we did get the movement in the ankle. Now on this side, I am going to give a quick squeeze. And how does that feel?
It's a little bit more painful.
More painful?
Than when it started, yeah.
Deep or superficial?
Kind of superficial.
Superficial, okay.
Just squeezing on something.
But we did get the movement in the ankle, so we do not have an Achilles rupture on this side.
Okay.
Okay. So now at this point, I am going to get you to, what test do I want to do? From here, I can do a Talar tilt test. So basically, I'm going to, this is your unaffected side, so I'm going to start here. I'm going to just basically evert and invert your foot on my own. Any pain there?
Nope.
Nope. Now I'm going to take it into dorsiflexion and evert and invert. Any pain?
No pain there.
Plantar, evert, invert. No pain? Okay. And this one I'm going to start in normal. And can I tilt at all?
Ow.
No. Yeah. Okay. Yeah. So I mean that's positive for ligament damage. And so I don't want to hurt it anymore by putting it into more, like into dorsiflexion and plantar flexion.
Okay.
So that's enough for that. So for this one, and I'm just going to do a quick anterior and posterior drawer test, which tests the same thing. So does that hurt at all?
No.
No? So anterior drawer, posterior drawer. Mm-hmm. And I'm going to test the same thing on the other side. Mm-hmm. Does that hurt?
Yeah.
Yeah, and that hurts. Does that hurt as well?
Yeah.
All right, so that doesn't really tell me a whole lot other than there is ligament damage in your ankle.
Okay.
I'm just gonna add that. Great. So at this point, I'll get you to flip over onto your back.
Okay.
Turn over onto your back.
Turn over.
I am gonna do just a couple of knee tests because the likelihood of you injuring your knee with your ankle is similar. Yeah, so, hang on a second. This is your right side. I just don't want to hurt that knee, that ankle there. Okay, great. So for this one, basically I'm just gonna put the stress on the medial and lateral sides of your knees to test if we sort of have any medial or lateral ligament damage in your knee.
Okay.
Which could possibly happen because of an awkward fall or something like that.
Right.
So I'm gonna press on the outside of your knee.
Okay.
Do you have any pain on the inside of your knee?
No.
No, okay. And same thing with this side, I'm pushing on the inside. Do you have any pain on the outside of your knee?
No.
No? Okay, so that's your unaffected leg, that's normal. Now, I'm gonna push on the lateral aspect of your knee, and I want you to I'm gonna push on the inside of your knee, and I'm looking for pain on the same side again. So I'm pushing on the medial side of your knee. Does that hurt?
Hurts a little bit on the outside.
Yeah? Okay.
Yeah.
Yep. And then any pain from this side?
No, none of them.
No. Okay, so just the lateral, which is to be expected sort of with an inversion sprain. You go down on the outside of your knee and you cause that lateral collateral ligament to possibly stretch.
Okay.
So we'll just add that in. And then one more thing that I would like to do is just a little bit of muscle testing. So we are going to test the peroneal tertius because that's the one that sort of dorsiflexes and everts. So we'll start with the left side. So for this one, I am going to apply resistance, and I want you to bring your toes up and the base of your foot into the middle of your, into the middle. Okay, so ready, go ahead. Yeah, all right, that's great. So that's a 5 and a 5, that's normal.
Okay.
And then the same thing on this side, so I'm just gonna see if you can give me any sort of resistance. Yeah, not very much. Okay, so that's about a 1 and a 5.
Okay.
And I mean, that basically tells us the peroneal tertius is likely to get injured on an inversion sprain. So that sort of gives us a baseline for next time. We can do more muscle testing in the future, and we might be able to sort of just gauge our progress as we go.
Okay.
Okay, I'm just gonna add that in. All right, so basically at this point, I'll get you to sit up here.
Okay.
Thank
you.
Yeah, you can slide down. So basically at this point, you want me to take this out? We are dealing with an acute ankle sprain, so I mean, we're not gonna treat it too aggressively. We're gonna focus on sort of compensating muscles. But all these tests sort of give us a great baseline for your healing progress and sort of where we can go in the future with your treatment.
Okay.
Okay, great.
Sounds good.
Do you have any questions?
I don't.
Awesome.